Thank you for joining us today. My name is Sarah Judd-Lamb and I'm the Executive Manager, Policy Development and Research at Carers New South Wales. And welcome to our third and final session in the Lunchtime Learnings series that Carers New South Wales is delivering this Carers Week. This session and this series have been developed as quick updates for busy professionals and busy carers to just get across some of the new initiatives that Carers New South Wales and our partners have been working on. So on Monday, we had a session around the Carer Survey. On Wednesday, we had a session on the Research Library for the Carer Knowledge Exchange. And today we are talking about natural disasters. Now, before we move into our slides and our content today, I just wanted to note a couple of things. First of all, you'll notice that we're in a webinar format today, which means attendees are not able to see each other, just our panelists. It also means that if there's questions and answers, there's a couple of ways to put those questions to us. So through the chat function or through the Q&A function at the bottom of your screen. And since we are talking about natural disasters today, we're just aware that those that are joining us may have been impacted by natural disasters in the past or be impacted currently. And so we just wanted to flag that that can be challenging, and if anyone's affected by anything that's discussed today and needs support, we'd encourage you to do so, and we've put some information in the chat about that. So if we can go to the next slide, please. I also want to acknowledge the traditional custodians of the lands that those joining us today are on, which for myself and my team is the Gadigal land and Gadigal Nation, extend my respects to elders past and present. And just, I think there's some other things showing up on the slides there, Mel, on the screen. If we can go to the next slide, please, Mel. We just wanted as well to introduce Carers New South Wales as the peak non-government organisation for family and friend carers in New South Wales. And we are delivering these sessions this week as part of National Carers Week, which if we can go to the next slide, please. So National Carers Week is celebrated annually, and that is around recognising the contribution of the 2.65 million carers in Australia, over 850,000 of those in New South Wales. And we're nearing the end of Carers Week now. Tomorrow is the last day, and this week has been a very busy week for anyone working with carers, but Carers New South Wales ourselves have delivered a series of events, both in person and online, including this one, and all recordings of online events will be available later on, including of this session today. We can go to the next slide, please. Fantastic. So this session today, we're going to hear from a few different people from Carers New South Wales that have been working in the area of natural disaster response and preparedness. So we're hearing from Wendy first up about the resources that Carers New South Wales has developed for natural disaster preparedness planning. We'll then be hearing from Melissa in the policy team, who'll be talking a little bit about our service response in flood-affected areas of New South Wales. And then finally from Courtney, who is leading a new project that Carers New South Wales is delivering in partnership with some other organisations that focuses on preparedness. And we hopefully will have a little bit of time for Q&A if there's any questions arising at the end of the session. So if we can go to the next slide, just a reminder that this webinar format, to ask questions or to make comments, you're welcome to do so in the chat feature or using the Q&A function at the bottom of the screen, and we'll hopefully address those. So I'm going to now hand over to and introduce Wendy Hill, who is in our education and training team at Carers New South Wales, and Wendy's going to talk about co-designing disaster planning resources for carers. Thanks, Wendy.
Fantastic. Thanks, Sarah. During the 2020 bushfires, we had some increasing concerns over carer preparedness for disasters. And we're really talking about whether it's bushfires or floods or other common sort of natural disasters carers may experience. And what we were finding was for many carers, disaster planning wasn't even on the radar. They hadn't even considered it. Some of them were blindsided during the bushfires. They weren't prepared at all. Other people had a plan and they found that they were underprepared. They also weren't quite sure where to go to for support before, during and after the disaster event. So we had a lot of confusion. We had carers being turned away from evacuation centres because their needs were too complex. We had carers thinking they could go to hospital, but people obviously are admitted to hospital for clinical or for medical reasons, not for safety during a disaster event. Next slide, thanks, Mel. So what we found was there was a huge amount of information, and it could be quite overwhelming for people that were embarking on disaster planning for the first time. So we know from our policy team consultations and from lived experiences of carers that we needed to help carers navigate that a little bit better. So we looked at the supports before, during and after different disaster events. We also looked at all of the information on the plans that were available. And this slide is deliberately busy because there are so many people that get involved during a big disaster event, and it can be really overwhelming for people. Next slide, thanks, Mel. So what we worked on with Carers New South Wales is we were looking at putting together a series of workshops for carers to help them better plan for natural disasters. We wanted to support that with a handbook, but we found that even when we were collating all of that material, carers were telling us that was still quite overwhelming. So we had an emergency care plan, and we then were co-designing and seeking feedback from carers with lived experience of disasters, as well as industry experts. And that led to the creation of some more simple resources. So a one-page evacuation plan, a one-page go kit checklist, and some really, really simple messaging to support people during disasters. Next slide, thanks, Mel. So you can see that we ended up with a high-level summary of what people can do when they're planning to evacuate in a disaster. So this is just one example. The key takeaways for us really are that the messaging and the communication needs to be very, very simple. It's so easy to be overwhelmed. There are things that carers can do, very, very simple things, such as keeping important documents in one place and maybe having a large box to put things in. And finally, the people that had a plan, even if that plan kept changing, responded and recovered much better than carers without a plan. Thanks, Sarah.
Hi, my name is Melissa Docker, and I'm the Senior Policy and Development Officer here at Carers New South Wales. And building on what Wendy was speaking to, I'll be speaking to supporting carers through natural disasters, and specifically our recent experience in the 2022 floods. There was significant flooding across New South Wales from February to April in 2022. Much of that affected the northern New South Wales coast and inland, which is where we deliver Carer Gateway services as well. So many of the carers in that region were significantly impacted. In response to the floods, there was a number of approaches that we took to ensure that carers were supported. That included providing information, and centralised and current information that was up to date, which included information about how and where to access support that was available. We had our service response, which was our Carer Gateway outreach activities in flood-affected areas throughout northern New South Wales, and that involved coordinating with Resilience New South Wales and co-locating in Service New South Wales recovery centres. And as well as this, we had our advocacy activities, which involved consultations with carers who raised some concerns around the things they were experiencing in those regions. But it also included setting up regular contact with our service response, so our outreach teams, so that we could get that direct feedback for what was happening on the ground. And those three elements really informed each other in terms of how we supported carers through that, and some of the things that we learnt from that. So we set up regular meetings with our outreach team, as we mentioned, and that informed our advocacy, and that included writing letters to ministers, as well as 2 submissions that we made in response to flood inquiries in New South Wales. There were a number of key issues that were raised throughout that time that we were supporting carers. So that involved difficulty evacuating, difficulty accessing accommodation, and that includes emergency accommodation as well as temporary accommodation for the mid to long term. So a lot of the options for accommodation just weren't suitable for people that were providing care to somebody who was aging or with a disability, mental ill health, and a number of other conditions. Access to available supports was also another further issue. So while there was a number of supports available, a number of grants, initiatives, we were finding that carers were needing a lot of support with form filling. Many didn't have access to digital devices such as laptops, which they may have lost in the floods themselves. And there were significant delays for those supports to come through, especially the financial support. We also saw access to essentials as a big issue. So while many people affected by floods were having difficulty accessing essentials, for carers, access to things like specific dietary requirements that couldn't be accessed through normal food support packages, or access to medication, equipment that might have been damaged or lost. They were some of the key issues, and carers were having a lot of difficulty accessing replacement items. And the other element that was raised in our consultations with carers was just limited care sector visibility. So attending those Service New South Wales recovery centres, and as well as those outreach service on the ground, there was limited, there was a noticeable limit of aged care and disability services, not the service providers themselves, but the service system representatives, so from My Aged Care and the NDIS, to try and get services back up and running in the community. So the key learnings from our flood response was that, as research shows, carers are significantly impacted by natural disasters, but the 2022 floods and severe weather events were no different. From hearing from carers, we've kind of noted that there's a need for inclusive disaster preparedness, which Courtney will speak a little bit to shortly, clear and centralised information, a coordinated holistic response with, really importantly, care sector inclusion, that they're there and they're present on the ground, as well as in the response. Support and access to the services and initiatives, support to access the services and initiatives that are available, and finally, accessible and appropriate emergency and temporary accommodation. Thank you.
Hi everyone, I'm Courtney Jones. I'm the program lead for Care to Prepare, which, as mentioned by Sarah earlier, is a program that's being delivered in partnership with the Physical Disability Council of New South Wales and GoCo. So during this short presentation from me, there will be some questions pop up as a poll or to answer, for you to have a think about where you are now and where you might like to go in terms of disaster preparedness. There they are. So if we could have the first slide, please. So the question for this presentation is, what can we learn from working with carers affected by natural disasters? And the answer to that truly is that those learnings are unlimited. When we're working with carers in a person-centered way, we have access to a diverse range of perspectives and views about the best way that an individual can take care of their needs during those disasters and emergency times. And as Wendy mentioned, people who are aware of the threats to them and have a plan that they're involved in developing, they bounce back quicker and have higher levels of faster recovery and resilience. And they also experience less trauma. So people who are part of that planning process are also building skills and capacity that leads to increased capacity within the household or family and then into the community. We also believe that the person-centered approach to disaster planning is the link to the psychosocial preparedness. And that's about really helping to improve the mental and emotional well-being of carers and their care recipients during natural disasters and recovery phases. We know that carers experience significant psychological stress as a result of the work they do and other life factors. So disaster planning that is person-centered and embodied in everyday thinking is really about building that resilience and longer-term well-being for everybody that is involved in the care of that person. The next slide, please. We'll just move on to our next slide.
I think we might be having some tech issues with the slides, Courtney. Apologies. Feel free to just continue and we'll see if we can fix it.
That's okay. So How do we achieve this? Well, there are multiple ways to inform, upskill, and educate and build capacity. There are so many pathways that can be utilised. And again, because we're working with groups of diverse abilities and unique aspects and perspectives, we can really utilise all of these ideas to help develop skills, tools, and training that will appeal to more and more people. So this comes back to the notion of universally designed education and resource materials. Because we are taking this person-centered approach and this universal design perspective, there are so many opportunities for partnerships and collaborations that the field for inclusive emergency planning is really so expansive. So there's so much opportunity in this space right now, and it's really a great time to start thinking about how we can do this. By introducing these multiple approaches and universal design, we're really, again, building in that resilience and equipping the community to effectively withstand and recover from major events in their life. And that truly is what resilience is. Next slide, please. So how do we, where do we start and what is the view that we take here? And I believe that the way that we must approach this is through a long-term focus. This isn't something that we can quickly tick off a list and get it done. It must be something that is embedded in emergency planning processes at all levels and become business as usual for government, business, and community. I'd also like to again point out, and everybody knows this, that people with disability and their carers need to be equal partners in the policy design and resource development that directly impacts them. We could look at things like disability inclusion action plans speaking directly to emergency management planning processes. We can look at things like legislating building codes for universally designed buildings and housing, so that if people are displaced and do need to go elsewhere, there are far more options for them to go so that they can begin that recovery process. And we also need to have a focus on outcomes-based funding, because we know that after a major event, there's a lot of money that goes into certain communities, and these are often for short-term projects that have very stringent KPIs that don't really speak to a longer term outcome that builds resilience. So I'm now working on a process to really seek to understand what is currently out there that supports carers and their care recipients in the disaster planning space, what's working, what's good, what needs improvement, and what's not there that we could potentially develop. And so there's some links there in the chat for an opportunity to engage with me on that process. And I'd love to have a conversation with you and hear your thoughts and experiences with natural disasters. Thank you.
Thanks, Courtney, and thank you all. So we're perfectly to time, and we have still some time to look at some questions. But before we do that, I might just draw your attention to that slide, which speaks to what Courtney just mentioned, and the links that are in the chat. Please do, if you have experienced natural disaster and you're happy to discuss what was helpful and unhelpful about that experience from a carer perspective, or from the perspective of someone with lived experience, disability, or ageing, you're welcome to express your interest in those sessions. But also, if you have any access to networks where that might be promoted, we'd like to speak to as many people as possible in New South Wales from these groups that have been impacted to inform this new project. Mel, I think, was there a slide before that one? Yeah, I just wanted to, I guess, end the presentation parts of this session by drawing your attention to the key links or contact points for each of our presenters today. So you heard first from Wendy and the education team, and we've included the two links there to where, back again. Oh, yeah, thanks. We've included the two links there to where the resources that Wendy spoke about are located on the Carers New South Wales website, and also where you can find scheduled sessions for the training that we deliver on disaster planning, and the education email address there. If you have any questions about those resources or training, you're welcome to contact our education team. The second presentation from Melissa, even though that was from a sort of policy team perspective, referred to the service response that our Care Gateway team, Northern New South Wales, has been delivering, and that area of New South Wales, Carers New South Wales delivers Care Gateway services, as you can see there: Hunter, New England, Central Coast, and North Coast where we have flood relief navigators working, and have been, our outreach team has been attending a lot of recovery centres and other places in that area. We have a new office that's opened in Ballina as well to assist with that. So if you have any questions about that response, I've just included the policy team email there so that Melissa can respond or redistribute those questions elsewhere as needed. And then finally, Courtney had posted her contact in the chat as well. There's a short link there to just very brief information about that new project. More information will be made available soon, and you're welcome to email Courtney as well with any questions about that project. Now that we've finished delivering that information, let's move over to some questions and answers. So I can see we've already had a comment come through in the chat. If those joining us would like to ask any questions or make any comments, please feel free to do so in the chat or via the Q&A function. I can see we've had a comment there around people living with mental health issues have had poor experiences and the sort of compounded impacts of the pandemic. Absolutely, look, thank you for that comment. And I know we had our Carers New South Wales conference last Wednesday, and we had a panel in the afternoon with a few different people bringing perspectives on the natural disaster impacts for carers and the people they care for. And we discussed a lot how COVID has only made those impacts worse in the last couple of years, just, challenge upon challenge. That's been really, really difficult all around. And similarly, it's interesting that you've noted the mental health experience, and the project that Courtney was talking about does focus on people with disability, older people and their carers. However, that's our sort of summary of our target groups, and it definitely includes anyone that is caring for someone with ongoing needs or reliant on a carer. So mental health and health conditions are not excluded from that project. And yeah, just noting the further comment there around COVID being its own issue for sure. And I think, to some extent, COVID can be seen in the light as another disaster, a form of emergency response and disaster. And so I should also perhaps Wendy or Jade could put in the chat, in addition to those resources and events that I mentioned and they're on that slide specifically focusing on natural disasters, we also have a number of resources and training that focus on COVID as well. So I think you can probably actually find them on the same links, but that's definitely something as well that's been a big focus and obviously has impacted carers' wellbeing. So thank you very much for those comments in the chat. Were there any other questions or comments from our attendees? I can see we've had one come through there about employers. So we've had a question that says, what do we do when our own employer refuses to acknowledge us as carers and forces us to work in COVID testing centres? So I think probably this is a little bit out of what the panellists today have presented on. But I guess in terms of employment rights, that's something maybe that the policy team could speak to. So I would suggest that we maybe follow that up offline and direct you to some information we have around how to deal with challenges in the workplace. I am not sure whether someone in the team that's online could look. I will put our policy in the chat. It's also on the slide, but I'd encourage you to get in touch with the policy team about that question, because we do have some information that might assist around employment. So thank you for that comment. We've had another couple of questions come through, which I might turn to, and there we go, there's the link. Thanks for that, Jade, in the chat. So that would be excellent. Thank you for that, MP. We've had a couple of other questions come through, and so one which I might throw over to some of our panellists. Wendy, Mel or Courtney, would anyone like to respond to the question, where can carers go for individual support with disaster planning? Would anyone like to comment?
I'm happy to briefly speak to that. We are, as part of the Care to Prepare program, early next year, we'll be launching a component that is all about in-home readiness, household readiness, and there will be an opportunity to have somebody in the core parts of where the program is being run to come into the house and assess the risks. Where that is outside of the area, we also have the resources that are on the website are very helpful for individual support, and Red Cross, in partnership with PSET Planning, has the Get Ready kit. So there is a lot of information out there, and I would certainly guide you to the resources that are currently on the Carers New South Wales website as a first port of call. And I'm happy to speak to you further about additional resources. So do get in touch with me via email, and I can direct you to other more specific things for your area or risk profile, be it flood or fire.
Wendy, did you want to add anything on the?
Yeah, fantastic. Thanks, Courtney. I thought I might add to that because it can be a tricky question for some people. So if you're caring for somebody that has formal services in place and a service provider, one or more service providers, potentially case managers, often it's a really good idea to involve them in your disaster planning to see what sort of support they may be able to offer you. And we've had a few carers also explore whether Carer Gateway might be able to offer some individual coaching to them to work through their own disaster plan, particularly if they've got a complex situation at home. I'm not sure if you've got anything that you potentially could add to that, Mel.
I think that it has all been covered off on. Thanks so much, Wendy and Courtney.
Thanks for that answer. And just responding to the latest comment in the chat, I'm just going to post the link to, we have a fact sheet on rights at work, which I think the pandemic question relates to. So I'm just going to post that there for you, MP, to follow up. And we've had another question come through on the natural disasters topic, which is why are carers worthy of a specific focus when it comes to natural disasters? I know we've touched a little bit on this, but Mel, did you want to kick that one off?
Yeah, so carers are disproportionately impacted by natural disasters. They're more likely to live in rural and regional areas where natural disasters are often more common. They're also more likely to be highly disadvantaged and potentially be living in houses that are more affordable due to the risk that they carry of being impacted by natural disasters. But not only are they more likely to be impacted, they're also more likely to experience longer ongoing impacts of those disasters, especially in relation to accommodation and financial impacts. As we mentioned, some of those things that carers were experiencing and reporting to us during the floods of not being able to secure accommodation and paying highly inflated accommodation rates for something that's suitable and accessible, that if they're caring for somebody with mobility challenge, requires support with mobility or mobility impairments and or equipment, they might have to pay significantly higher levels of rent or to be able to afford something that they can move around in and continue providing care in. And some of those emergency and temporary solutions, such as the housing pods, which are fantastic, aren't necessarily suitable for someone who's got to provide care or get services into the home. On top of that, also replacing equipment and medication, it can be really expensive when the price of food might have risen because there's some challenges getting food out there, or if you've got dietary requirements, that can make that even more difficult. And all these compounding factors often lead to greater impacts also on health and well-being, so higher levels of psychological distress and lower well-being, especially where services might be impacted and unable to continue to be provided, and a carer's got to provide more care. It might have a greater impact on their employment and finances. So all of these combined impacts, which, as I noted, are often prolonged for carers and the people they care for, and not just carers, but often the people they care for as well, it's important to really have that focus on carers and carer inclusive, as well as inclusive of other groups that may need additional support or assistance in natural disasters. But there's definitely a place for highlighting the needs of carers and really focusing on inclusion.
Great. Thank you, everybody. We've unfortunately run out of time. So I've seen we've had a couple more comments in the chat. Again, feel free to email our policy team email address if you want to continue those queries. And thank you for that last comment around evacuation. That's certainly something we've been addressing in our advocacy. So please do stay in touch. If we can move to the next slide as well. Thanks, Mel. And just to reiterate, if you'd like to be a part of these consultations that specifically focus on floods and fires and impacts on carers and people they care for, please do so. And that is it for the session today. We'll be sharing the recording with those that registered. Thank you very much for making the time to participate, and please do access further information and support if you need it. Thanks, everybody.